Dr. Jeffrey Joyce. Dr. Joyce has been with FSU since 2017, having been engaged in biomedical research, graduate education, and research administration for more than 30 years. An internationally known researcher and pharmaceutical consultant in central nervous system drug discovery, Dr. Joyce's work has led to target development for drug discovery in both schizophrenia and Parkinson's disease. He has published over 150 original papers and book chapters in a diverse area of neuroscience topics. Dr. Joyce, thank you for joining us.
Hey, good afternoon, everyone. I'm going to make this presentation short, but I wanted to talk with you about some of the success this award has had for Florida State University already. For those of you who don't know, the Clinical Translational Science Awards are awarded from NCATS, a division of the National Institutes of Health. There are 55 hubs receiving those CTS awards currently. We are the only one in partnership with University of Florida that includes two medical schools. Although, as you should know, it's all of the UF Health Science campus, and at Florida State University includes a minimum of 7 colleges engaged within that. The University of Florida funded their first, got their first award back in 2009. We were not actually part of that first award, but we were engaged with University of Florida through state funding for the College of Medicine's Network for Clinical Research, and work being engaged with our satellite campuses, our regional campuses throughout the state of Florida. They then got CTSA, what they call CTSA 2.0 in 2015. We became a community partner. So medicine worked with them on engaging largely University of Florida researchers and our network of clinical research training, and to establish clinical research, clinical trials at our regional campuses. As you'll hear, when I came on board, I really felt that we really needed to engage much more of across colleges at Florida State University with this effort. So the renewal that was submitted in spring of 2018 and awarded in July of 2019 has us as a full integrated partner with the University of Florida, and awards both direct dollars and indirect dollars and support from both the VPR's office and the Dean of the College of Medicine. You'll see in the upper right, the executive committee, made up of faculty from 7 colleges, came up with a mission statement for the CTSA at FSU, which is to engage in translational science that engages communities in developing and testing biobehavioral interventions across the translational spectrum to address social cultural determinants of health. Next slide, please. This work really began well before I joined in 2017. As many of you know, we already had existing translational health science in College of Medicine, nursing, social work, and psychology, to name a few. So I engaged the executive group across UF and FSU to discuss how we really had an impact in community engaged translational research, particularly in mental health and behavioral health. And so that is what has engaged us, and that is what is part of the impetus for funding of this award. At FSU, the steering committee and I, along with Michael Nichols, oversees 7 different teams, which includes our K-Scholar program, Medical Student Research Integrated Program, Bioinformatics, Epidemiology, and Research Design team, the Network for Clinical Research and Training, which is largely within the College of Medicine, our Team Silence pilot grants, which I will talk about, a community engagement, which includes both University of Florida and Florida State University leads, and our network science, which includes both University and Florida FSU leads. The K Scholar program has two separate additional parts, including Team Science, which is led by Carla Wood in the College of Communication and Information, and our Mentor Academy, which is led by Rachel Golf, our Britain from the Office of Research Development. I'm going to talk about the K Scholar program next, please. So this is a translational workforce that includes all three programs that I discussed in the leads. Next slide. Our KL2 program at Florida State University is led by Sylvie Nahr, who's Professor of Behavioral Science and Social Medicine and Director of the Center for Translational Behavioral Science. Next slide. K-Scholar programs are supported through two different mechanisms, directly through the CTSA hubs, and secondly through the NIH for the KL2 program. All CTSA program hubs have a specific KL2 program, which offers formal research training experience to scholars who already have an MD, PhD, or equivalent doctoral degree. These KL2 awards support mentored clinical research across a broad spectrum of translational science, who have recently completed their professional training and are commencing a translational and/or clinical research career pathway. The CTSA program helps select KL2 candidates, provide them with a rich career development of experience in multidisciplinary setting. The KL2 appointees, referred to as clinical research KL2 scholars, come from a wide variety of fields, including medicine, dentistry, nursing, behavioral sciences, biostatistics, and epidemiology, but can also include education, engineering, any college, any area. Our K-Scholar program at Florida State University includes the lead Sylvie, K-program, college program coordinator Carolyn Blue. We currently have 16 K-Scholars, 8 are from the College of Medicine, 2 from the College of Communication and Information, 3 from the College of Nursing, and 1 each in education, social work, and computer science. We provide course offerings, workshops, and mentorship support for a path for early career investigators to transition to a successful KL2 grant from the National Institutes of Health. Currently, we are funding through our hub CTSA award, Dr. Julia Scheffler, who won the UF-FSU KL2 multidisciplinary grant for the 2021 through 2022 funding period. And our internal funding for a KL2, or which we refer to as an internal KL2 scholar, is Dr. Laurel Reeds of the College of Education, who also was competitive for the Hub Award. And while she didn't win it, her scores were sufficient for her to be awarded the internal KL2 award for the 2021-2022 funding period. Next slide. We also seed funding for new team science. We developed and identified these teams through use of key terms, identifying faculty clusters, working with them to develop cohort themes, forming the teams, and developing RFAs to fund those. In 2019, we had our first team science RFA, which I'll discuss in a minute. In 2020, we did a rural health RFA and funded 3 teams. In this year, we worked with University of Florida to support new University of Florida, Florida State University teams through using 2 different strategies, which I'll briefly go over, utilizing network science and identifying specific theme areas. Next slide. So 2019, the committee selected from 8 submissions, two awardees, and these had to be faculty who had not submitted a proposal previously. And so we identified them as a new team, and they had to be, while we had hoped for new from different departments, we identified those who had not previously worked together. And one of those was Derek Nee and Greg Hajak. They've successfully completed their work and submitted an RO3 and expecting to submit an RO1 this next year. And then Dr. Julia Scheffler and her team won one of those and has utilized that to support her KL2 submission. For 2020, in October 2019, we brought 21 faculty together from 9 colleges. They formed new teams, developed themes in rural health. I worked on an RFA to support them. White papers were developed from 5 of those, and 3 of them were awarded funding, including, as you can read there, from Joe Grivich and his team, one to Aaron and his team, and one for Tanya Wren in her team. For the brevity of time, I'm leaving these up to them. They had to pivot during COVID-19. They all 3 did, met those challenges, and Aaron's team, along with Marcia, have successfully applied for NSF funding. Next slide. This is a unique approach that University of Florida and our teams through the CTSA are trying to do. And we're trying to test every different pilot model to see how we can develop new teams. And what they utilize is network science to identify key terms from researchers at both University of Florida and FSU who had never met but should be working together. They submitted 20 of those identified pairs, invited them to participate in a pilot program, met with the interested pairs to explain the opportunity. And if at least one person in the pairs was interested in the program, they submitted a proposal. Of the 20 pairs, 7 participated and submitted a letter of intent, and 5 pairs have been invited to submit a full proposal. In August of 2020, we identified from UF and FSU faculty who should be interested in mental health, health disparities, cardiovascular disorders, and maternal child health. We had them meet, we identified team leads from that, worked with them to see if they would want to continue to work. And then in February, issued a joint RFA to support new teams in those 4 areas. And we had letters of intent submitted. For any of those who submitted a letter of intent, we did a design studio to provide feedback on how to improve those submissions. And we are expecting a minimum of 8 submissions Monday, April 12th by 5 p.m. And that funding will be jointly supported by both UF and FSU for both of these awards. Next slide. So this is a fully integrated model. We continue to work across all the teams and support between UF and FSU. I invite you all to go to our website to see all the updated information, including how to submit service tickets for any services that are needed. With that, I'll take any questions that you have. Thank you, Mike.
Thank you, Dr. Joyce. Folks, if you have any questions, please feel free to put them there in the chat box. We'll read them out. So, Jeff, I wanted to ask one question about who can engage with CTSA programs at FSU? Is it just health sciences folks? Is it everyone?
No,
Can you tell us a little bit about that?
it is anyone and everyone, and we work with Okra to make certain that there's an integration of services, so that there's support wherever that occurs. Currently we have more resources in certain areas. But I think you can see by the pilots, those are broadly supporting. We're up to 11 faculty from 11 different colleges now that have been given, have submitted and will be receiving support. And we're very, and we expect, while much of our work obviously is in translational science, we're also doing awards in precision health, which really is far more at sort of the basic science level, and we expect in the next submission to be supporting even more of the basic science and translational science pipeline through new initiatives.
Could you tell us a little bit more about some of the community engagement programs you have going on?
Yeah, so Dr. Joe Brown Spates, who is chair of family medicine and rural health, heads up our community engagement group. She has a community board made up of 6 community facilitators and 3 faculty from social work, medicine, and nursing. They hold annual symposia on community health impact. They have been identifying what this community in the Big Bend area needs as essential health services. And one of those is certainly in mental health. And I think, as many of you know, Dr. Heather Flynn helped establish a center for mental health that which is a combined FSU Appalachia Center, also supported by 5 different colleges as a multidisciplinary effort. And that was directly a response to the community needs for community-based behavioral health interventions based on science, but it will also be a focus, an area to do research and training for graduate students and professionals. They also work closely with University of Florida's Health Street, which is a much larger community engagement group, and are working now on piloting studies in community groups here in the Big Bend area to impact changes in health outcomes here.
Well, excellent. And just one last comment I see here in the chat, April wanted to point out that Dr. Carla Wood, one of the CTSA leads, heads a great team sciences workshop and training program. I would absolutely second that comment. I went through it myself this past semester here. It is very valuable, and I think is a really great opportunity for people who have come here today to Collaborative Collision to learn a little bit more about how to work together. Collaborative Collision helps you to learn who to work with. Carla can help you learn how to work with them.
And I want to do a shout out because that is co-led by Carla and Wayne from University of Florida. They not only do the team science workshop here, they now do those at University of Florida. So this is a real UF-FSU model of integration for support.
Awesome. Yeah. And so with that, folks, if you have any last questions for Dr. Joyce, is your email address on here? It is not, but I assume you can find it.
I'm sure they can. They do. So thank you. Thank you, everyone.
Thank you. Really appreciate you coming here and being part of this, and for your continued support of Collaborative Collision.